Oh yeah. What mortgages are easy. See if he can apply by the end of the month because rates are going up
All
next month.
right, welcome everybody. We are doing something a little bit different today for our Facebook Live. We are going to do a little bit less of just me talking and explaining things, and we're actually going to have a demonstration here. So, what we've been talking about this month and promoting here at the clinic is we've been talking a lot about chiropractic care for animals. I recently graduated um, in this past December with my degree in animal chiropractic from the Healing Oasis. The official title of the degree is Veterinary Spinal Manipulative Therapy. So the letters at the end of my name are VSMT, but that's what that means. Okay, so couple of questions I get off the bat, I'll just address those before we get kind of into a demonstration here. Is one of the big questions I get is who is able to do chiropractic on my dog or my horse or my cat or anything. So the only people that really should be doing it is either a licensed veterinarian who's completed further education in the subject or a licensed human chiropractor who's completed further education in the subject. And so those are really the only two people that should be performing it on the animal. The reason being, okay, is that not everything can be fixed with a chiropractic adjustment, and not everything should be. And so it's really important to have that education behind you so that when you do a full evaluation of the animal, you're going to know whether or not it's actually appropriate to do the adjustment. The adjustments themselves, okay, if you're just learning method and you don't understand the reason behind it, okay, you could physically do the motion, but you could actually make something worse instead of making something better. The other thing to watch out for, and this is a lot of times how people have bad experiences, one of the ways, is if you're doing an adjustment, you're stimulating the nervous system in a lot of ways. So you're sending a lot of signals back to the brain, and it is actually using quite a lot of energy. So the cells in your body and everything do go through quite a lot of changes. You also need to know when to stop. Okay, so that's where that additional education and training comes into play as well. You have to know when enough is enough and the body can't take any more. And then if that tipping point does get passed, you have to be able to help the animal with that. So, worst case scenario, for an example, is if you're out doing an adjustment, and this is something you really only see happen in very geriatric horses with a lot of issues. Okay, they can be helped a lot with adjustments. They can increase the mobility quite a lot, decrease their pain, be a lot more comfortable. If you go beyond the point where they can go, okay, they can actually end up colicking. So you get this um, reflex sympathetic response within the nervous system, and they can get colicky. And so what you need to do then is I being a veterinarian, I'm going to switch my hat. Okay, so I'm going to take off my chiropractic hat and I'm going to put on my veterinarian hat, and I'm going to tell you to walk them and give them Banamine and everything. And if they don't resolve, then I'm going to tube them and I'm going to treat them like a colic. Okay, so I can do that. Okay, if you have a human chiropractor come out and adjust, and you have a very old, very compromised geriatric, animal that they're working on, like I said, I still think it's good to have them come out and adjust. You can really improve their quality of life quite a lot. If you go past that tipping point, okay, and you exceed their energy that they have for themselves to do this adjustment, and they start to colic. Part of the additional training is the human chiropractor is able to recognize what that is. They're able to recognize that something bad has happened. They can tell you what's going on. They can explain to you that reflex sympathetic response and go through, exactly why this happened. And if you like, we can get further into detail with that another time. I just don't want to really harp on this, but just kind of drive from the point that they would have to just then have you call your veterinarian and have them come out. If it does happen, if you're able to recognize the signs, you can just walk the animal. Most of them will walk right out of it. I will give them a dose of Banamine because I can. But even if you just have a licensed human chiropractor out adjusting your animal, they're going to recognize those signs early. And a lot of times, just giving them a break and walk them around they're going to be just fine. But you do need to have extra training. So that's kind of your worst case scenario. You're also going to see a lot of things on YouTube that is not a chiropractic adjustment. So I just want to have a real quick, I'm not going to harp on this again, but really quick, what is a chiropractic adjustment? A chiropractic adjustment is a high velocity, low amplitude thrust, okay? So what that means is it's high velocity, so it's really fast, low amplitude, which means it actually doesn't take that much physical strength. All right, so I'm not a bodybuilder, right? But I can adjust a horse. How can I adjust a horse? Because I'm dealing with really, really tiny joints right there on the vertebrae. And I have Cindy here. She's going to be our demo pony here in a little bit. And one of the nice things about doing on a horse is it is a little bit bigger, so you can kind of see, potentially visualize a little bit more what we're talking about, because the vertebrae themselves are a little bit bigger. But you're talking about very small joints in between the vertebrae, and if you line up with those joints, and this is where you have to really know your anatomy. So like in the neck, it's a 45, 45, 45 angle is what you're going for with those cervical vertebrae adjustments, okay? If you line up appropriately in the line of how the joint's supposed to go, what you're doing with that high velocity, low amplitude thrust is you're gapping the joint, or you're increasing the space in that joint itself. You're stimulating the GTOs. You're causing this relaxation reflexively using the spinal cord and the central nervous system to do that. And you're going to help improve that flexibility, that mobility, and decrease that pain by sending the nice, good, happy signals up to the brain. Okay, so think parasympathetic, think relaxation, think happy thoughts, think sympathetic. You're going to think muscle tightening, okay, pain. You just don't feel good, right? So what we're going to do with these adjustments is we're going to increase parasympathetic. We're going to increase mobility. By using that nervous system, we're going to decrease pain, and we're going to keep the body moving and functioning properly. So that's the real kind of highlights reel, I guess, of what we're trying to do here. We can go in another one of these, go into more depths and everything, but I didn't want to spend this Facebook Live in a lot of the like lecture kind of settings as I usually have. Okay, so we're gonna do, like I said, something a little bit different. Gonna kind of jump into the demo at this point. I'll try to remember to talk as I go. A lot of times I do stop talking as I do this just because I'm thinking, but I'm gonna try to keep talking as I go and kind of explain out what I'm doing. One of the things you'll hear me just kind of shout out as I'm going through is I'm going to shout out what I'm adjusting if I've had to adjust it. So I don't shout out everything that I mobilize and what I'm looking for as I'm pushing on the vertebrae themselves, on the spinal column and all the joints, is I'm looking for what's called hypomobilities, or I'm looking for one of these little tiny joints that is not moving as much as it should. So what that tells me is that that joint needs gapped. I need to increase my parasympathetic. I need to increase that mobility and all of that. Okay, so if there comes a joint that I feel needs actually adjusted, I'll end up shouting out the which joint that is. Okay, and there's a language to it, but if you hear me say like C5 body right, okay, so that means that the fifth cervical vertebrae had a hypomobility with the vertebrae over to the right side. So I needed to adjust at a 45, 45, 45 degree angle on that joint from right to left. So that's kind of what that means. It's just a little bit of lingo. So if you hear me telling that to Katie here, who's going to help me with Cindy, that's just habit, because as I go through my adjustments, she helps me remember what I'm doing and make sure that everything gets written down properly. So you will probably hear me say that because I'm used to saying that. I'm going to try to also explain a little bit more what I'm feeling as I do different moves, so long as I can remember. You're going to have to give me a little bit of leeway with this camera as well. I'm going to attempt to make sure I'm in view. If I go out of frame, we're going to try to look up every now and then for each thing and just kind of make sure we're still within frame, and kind of go from there. So we are kind of working as well. I don't have anything that's going to track me, so I'm going to try to stay in this little box here so that everybody can see what's going on. So without further ado, really quick. This is Cindy. This is my son's. Looks like we're experiencing connective issues. I'm just going to tell that to go away. There we go. All right, so this is my son's pony. She suffered a bad accident in July of this past summer. She had what's called a brachial plexus injury. Okay, so your brachial plexus is this huge bundle of nerves that comes out of your lower cervical vertebrae and your first couple thoracic vertebrae, and it feeds all of the muscles and everything in your arm. Okay, so in her right front leg, the brachial plexus was not working. So that means she came in out of the field dragging her leg. She had no feeling, no sensation, no strength at all. Okay, really bad situation. We actually thought for quite a while we were going to have to put her down. We did chiropractic and acupuncture on her and a lot of supportive care. And what I'm going to do here, since I've introduced Cindy to you, she's got a really long, really interesting history with her injury, is what I'm going to do is I'm going to try over the next weeks or so to post some videos of her progress, kind of talk about her in a little bit more detail with her story of her recovery and what we think might have happened with her injury, kind of how those injuries can occur, those types of things. Now, Cindy is not 100%. She's still recovering, okay? So she probably is going to have quite a bit for me to adjust today. I purposely didn't adjust her for a little bit of while here so that we'd have a little bit more to show you guys. But she usually gets adjusted really regularly, so she's pretty used to this. She knows the routine. But what we're going to do, so let's say I come out or you come here. We are located at the Shenanigan Stables right now. There's a really nice facility. They're letting us use it today. And they actually work with us on a regular basis at the Carrollton Animal Hospital to look at horses and things here for chiropractic adjustments. So if you come here to Shenanigans with us, then you're going to see this arena in person. And what we're going to start with is we start with a regular exam. So I'm going to listen to the heart, I'm going to take the temperature, look at the gums, listen to gut sounds, feel the legs for heat, all of that. I'm not going to waste time doing all that with Cindy right now. I know Cindy really well. What I am going to do in addition to that is we're going to do a little bit of a lameness exam before we get started. So we're going to kind of truncate that with Cindy here. What we're going to have her do is we're going to have her walk away, walk back, trot away, trot back, and then normally we would also do a little bit on circles if it was more of a subtle lameness. Cindy, you're going to be able to see it, okay? So we don't necessarily have to do that with her. So I'm going to move this other bale out of the way here. Hey, Cindy. All right. Yeah. So Katie is going to go in a straight line here. If you just want to walk down, let me see how far the camera goes pretty well. Maybe to S there. You can come back. And then she's going to walk back. And what I want you to look at is, her obvious, her right front leg there. She kind of tucks it under as she walks. She crosses over with her left front over top of it. Kind of falls in a little there. But what you might have noticed too as she was going away is she's a little stiff in her back end too. Okay? She kind of goes funny there. Pretty common for them to get, if you have something going on, your main problem's in the front, for them to get hypermobilities and things like that in the back end as well. So horse people are really familiar with support limb and compensation and all of that. And so you're going to see a lot of that with Cindy here. So now we're going to see if we can convince her to trot. Trot. There she goes. So for the longest time, Cindy couldn't trot. Okay, she wasn't strong enough. So she's doing really, really well. Way better than ever expected. Here we go, girl. Well, a little cough. She's a fuzzy pony. All right, so you can see there, she doesn't go like those pretty YouTube videos of those nice fluid horses. Cindy's got some stuff going on, but she's doing pretty good for everything that's gone on with her. So kind of see where she is today. One of the things I'm going to be posting with her is videos similar to that. Usually you're going to see one of my kids leading her because she is their pony, kind of doing evaluations as she was recovering. watching that limb, seeing the strength and the support that she's able to give it, all that good stuff. The other thing you can't see with Cindy, because she is fuzzy like a woolly bear today, is on her right leg here. She's still missing a couple muscles, okay? So she has what horse people will know as Sweeney, all right? So the suprascapular nerve with her, it never really came back. So she's got hypertrophy of the muscles around it, which is giving her that support to her limb there, but she's missing a large portion of her supraspinatus and her infraspinatus, which are these two muscles here, and those are both innervated by that suprascapular nerve. So we know that nerve never really came back with Cindy. The other thing she's missing is she is missing a good amount of her pectoral on this right side. So her pecs are basically her boobs, okay? And that helps a lot with keeping that limb supported. Now there's other muscles on her, like I said, that have gotten bigger to give her that support. But she'll probably always go a little bit different because of that. So she's got some kind of permanent loss, but that's okay. She can still be really useful. She's still a good walk around. I think she's going to get to the point where she can be a good trot around pony. And then, hopefully we can get her strong enough and stable enough that she can do some hills and get back on the trails. So that's our goal for Cindy. So the other thing when you do this is you always want to know, where are you and what are your goals? So Cindy's still got a long road ahead of her, but she's going to help us do a demo here today. So usually what I do when I start horses, especially the first time, is I start with the legs. So I'm going to run down. I'm just going to go around and kind of do her legs. I'm going to try to say what I'm doing here. So can they see my, I don't know how to get her. So we're going to try to get her in the perfect spot here for you. Tell it to look down more. There we go. All right. Yeah, okay. All right, so we're going to do this leg here. So I start kind of on the bottom and I'm going to work my way up here. So they've got quite a lot of joints going on here. Good girl. Check out her sesamoid. So then what I'm going to do here is on her, this is the horse's knee, which is the anatomical equivalent of the human wrist. Okay, so there's a lot of little bones right here. I'm just going to mobilize all those little bones. You don't really need to adjust them with a thrust. They mostly just need mobilized. Stay nice and loosey-goosey. Check out her shoulder here. Okay, so with Cindy here, horses should be able to take their leg and touch the inside of the other leg. She can do that. They should also be able to come out more. She does it. So that's a hypomobility there. So what that tells me is her shoulder joint here is hypomobile, so it's rotated laterally. All right. So what I'm going to do is I'm going to do an adjustment. So I'm going to hold this limb here, follow down onto her joint. There we go. So then now let's check her, right? And now look at that. So now this limb can actually come out this way back at us, whereas before it couldn't come past vertical. So that was an example of adjustment. They're fast, they're close to the animal. I use what are called short lever techniques, which means I don't have, I'm not going to use an apparatus. I'm going to hit the joint at the correct angle right up next to it and be extremely specific. What you run into with long lever techniques is you lack that specificity. So yes, you may adjust what you're going to adjust, but you may also move other things that didn't need it. And you can potentially take something beyond its anatomical limit and actually cause an injury. So those techniques are a little bit more dangerous and, like I said, not as specific. So I do very close, very fast, very specific adjustments. There's nothing big and flashy about them, but they're very effective. So then what I'm going to do here, now that I've adjusted that, is I'm going to check her scapula. It's got really good mobility there. And then lastly, she's getting ready for it. What I'm going to do is I'm going to check her elbow here and then also her radius, so that feels back to a back leg. Where? I know. Give it up. Good girl. So you're going to come here. Again, we're going to start down here in her pastern, work our way up. Check her hock here, working on that talus. I'm going to check her tibia right there with that stifle. And we're just going to mobilize our hip a little bit. And this is a mobilization again, working on that hip joint. Okay, good girl. So that felt really good on her actually. I'm starting to get warmed up, so I'm going to shed a layer. All right, you want to spin around, we'll do the other two. Still in line? Yeah. All right, come here, Cindy. Good girl. 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 So she gave me a little bit of look on her left hip here. Hey, it was a little, it was a little hypomobile. She's getting in line. She's asking me to do a tail traction on her. We're gonna hold off on that for a second. I know, we'll do it later. So that's one thing with horses. If you do them regularly, they do like it, and they're gonna try to help you out. Be like, no, I want you to do that right now. So what I'm gonna usually do is I'll start with the cervicals. I'm gonna head down her back. I'm just gonna have her kind of look at me. Now she's weak on her right side, so what I'm gonna have Katie do is just stand on her right side, just because it is still a little bit difficult for Cindy to turn that much and put that much weight just solely on her right front there. Most horses don't have a problem with it. It's just something special with Cindy. So I try not to turn her head too far this way because I don't want to knock her over, but we do want to check her here. So she's got a C4, body left. Good girl. Easy. Good girl. So you can see she's trying to brace herself properly without putting too much weight on that right side, just because it is still a little bit weak with her. Good girl. There you go. We're going to go through and check her thoracic here. I'm just kind of pushing back and forth on her vertebrae here. With horses, if you grab their... Step back. Here you go. You're perfect. If you grab their scapula here, okay, and you run your arms up, here's about T3, okay, 4, 5, 6, 7, 8. Okay? So, one of the fun ways that one of my professors taught me to remember that is that horses like to shoot a 38 special. Okay? For some reason, that's just stuck with me. So, if you're ever curious about learning your own kind of anatomy right there, that's a nice little cheat for you. Most horses, I'd say 99% of them, will be T3 to T8 right there. Okay? Here we go. So we got a T12 spinous left. So we're going to come here. And she's kind of a interesting height for me to get at the correct height for this. Good girl. There we go. So that's moving much better now. You can actually see with Cindy, because she's so used to it, her whole body just goes. She's really relaxed the whole time. Horses are special in the sense that they have extra joints other species don't have. They have what's called intertransverse joints. This is not unique to just horses. Cows also have it. Your other ruminants will have it as well. But it's in between their sacrum and their last lumbar, and sometimes between the last two lumbar, there's these joints that connect. Okay, so I didn't give you a number because depending on your breed of horse, they may have a different number of lumbar vertebrae. Okay, so most horses have 6, Arabians have 5, and sometimes their crosses will also have 5. So it does vary a little bit, but so what we're going to do is we're going to check those joints here really quick. So here's my distal one. Good. That one needed adjusted, okay? The first one I just did a drop on it because it's through a bunch of muscles. It was okay. It moved really nicely. This cranial one needed adjusted, okay? She was really stiff right there. So we're going to check the dorsal component here. So now it's moving really well. She often has trouble with her intertransverse joints, which is why when I felt a hypomobility here, I decided to check that first before I went to try to adjust the lumbar, just because I know Cindy, okay? And I know that that was probably going to loosen up once I adjusted that intertransverse joint. So that's one reason why you might see me adjust stuff and then check a whole bunch of things, is because I might have found something that was a little bit hypomobile, but I didn't feel like that was maybe the main problem. So I'm going to check some other stuff, and I'll come back and make sure that that got cleared up before we finish for sure. Okay, now we're going to look at her hips here a little bit. So I'm going to be moving my bale a lot. I'm going to check her sacrum right here first. And it was a little bit dorsal there. She's got an apex left. So she's short, so I'm going to come here. Okay. I'm checking her pelvis now. She's got a left dorsal or left PI, posterior ilium. So there's lots of different ways you can adjust this, okay? You can either, if I was on that side, I would line up and push the top of her ilium here. Because I'm on this side, I'm going to actually do a hip drop right here. on her bone right here. We're just gonna pop it. That's moving much better now. So she actually, and this isn't too uncommon, she's got, I thought maybe this, because it felt more hypermobile than that, would get it going, but she has a little bit of an AS on the right side. So what does that mean? That means essentially to exaggerate it and maybe not make this as anatomically correct as possible, her pelvis was like this, okay? Completely crooked, as you saw, but that's just an exaggeration of what I felt so that you could visualize it and see. Check her sacrum again here. Okay, so now we're going to move over to the other side, and we'll go ahead and we'll spin her around so that you guys can still see what we're doing here. Good girl. Oh. You got to get close to the camera, sweetie. That look good? Yeah. Good girl. Huh? Yeah, you'll be fine. She usually does fine on this side, but if you just want to stand, she's used to it. So. Stand up. So you can see she'll turn her head a lot more this direction, and she leans into it because she feels comfortable putting her weight there on that left front. Girl. So she's got one right here. Good. I'm a little high, but it's, like I said, she's a little bit of an awkward height. Good girl. So, I did that. You saw I did that. Essentially, I did that one twice. Why? The first one, my angle was just ever so slightly off. So I didn't get the mobility that I wanted. So what did I do? I readjusted myself. I got down lower in my crouch. I made sure I was right at that angle with where her joint should go. And I did it again. And that one was much more effective. So I'm just going to feel her right here. I know. Good girl. So that's moving way better. And you can see her behavior as well. She's happy with me pushing on that now. Whereas before, she got a little bit impatient. Okay? That was a C5. Good girl. Okay, so I have a C4, spinous right. I'm going to come down, stand up. Good girl. Okay, so it didn't quite work. It wasn't quite fast enough because Cindy's not that stable on her front legs. So what I'm going to have Katie, my assistant, do here is I'm going to have you brace for me. So, like this, at this angle, vertebrae before, vertebrae after. So you're going to be right down there. And then just tilt your head down, just in case. There you go. Kind of protect your own neck a little bit. Stand. There, that was a good one. So that was much more effective with her. So sometimes we'll use assistance. If you're fast enough and they're stable enough, you don't need it every time. But always good to use when you need it. And if you remember what I said about where Cindy got her injury, her having a hypermobility right here makes a lot of sense, right? So that secondary curvature, right where that brachial plexus comes out, is right here. So that's right here in our lower cervicals and the first couple thoracics, right? So lower cervicals, we had to adjust. first couple thoracics. We see that a lot with her. So you probably couldn't hear that, but she actually gave us a pop on that one. That was her caudal intertransverse on the right side. So I mentioned that she has an AS on this side. I'll double check it, make sure to see if it's still there since we adjusted that intertransverse. So it's a lot better actually. I no longer need to adjust that because that's moving really well. It's bouncing back up into my hand really well. So again, that kind of just drives home why I do that. Essentially, I constantly recheck and just keep going back and seeing if it needs adjusted or not. Checking here. Okay, so Cindy feels pretty good there. We did a little bit more work around her sacrum, just getting her really, really loose, trying to keep that going there. So what are other things that I do, and what was Cindy backing up for? What the heck is this tail traction I talked about? So if you want to walk her forward a little. Cindy loves her tail traction, okay? She just always has. So, assuming your horse is nice around their back end, what I'm going to do is I'm going to reach up under the tail and I'm going to feel for a ligament. And the ligament I'm feeling for is called the sacroiliac ligament. And what it does is it runs straight up from the top of her pelvis right here and actually connects into the sacrum, okay? When you push on that ligament, you can kind of feel if your sacrum's a little bit hypomobile to one side or the other because one tendon will be way tighter than the other. And if you have a horse with chronic hind end issues, you can actually put a little nice pressure on that tendon. And the term for that is called Logan technique, and it releases a lot of parasympathetics. If I have a horse that's really tense in general and not really letting me get any good adjustments, I'll sometimes just sit here and just chit chat and put some pressure on these tendons just to release that parasympathetic, give them the happy response from the nervous system, and it kind of helps them to calm down. So they like it. Now hers feel good, okay? And then tail traction. Is tail traction where I tie her tail to a tree and then pull her with a truck? Absolutely not. You will see that on YouTube. That is not tail traction, okay? So there's a lot of coccygeal vertebrae in the tail. What am I trying to do? I'm trying to gap those joints just like I gapped the other joints, okay? Some horses really, really like it. So what you want to do is you want to get it perfectly in line with their croup. Keep it in line with their tail. And you have to be a horse you trust because I'm standing right behind her. And you just slowly add some tail traction. You can watch here. She's probably going to start leaning against me. She's going to stand up straight here. Good girl. Good job. So then we just kind of lean against each other here. She gave me a little pop on that one. She's leaning harder than my hands can hold. You can see I'm sliding down her tail here a little bit. And so then you just kind of hold this until basically my arms get tired, okay? Because horses who really like it will just want to keep going for a long, long time. And what you want to do though is you want to come out of it slowly. So I'm going to lean in slowly because I don't want to drop her. All right, so there we go. And then sometimes other stuff I'll do, especially if I have some tight tendons, is we'll do a little tail traction, and then we'll bring it up and just do a little bit here. So you can see Cindy's really flexible in her tail because she really, really likes tail traction. Good job, girl. Okay, and then what I usually finish up after we've got to know each other and we trust each other, from my experience, I've had better luck doing it last, is kind of looking at the pole area, because a lot of horses end up being head shy. So what I'm going to do here, and then I don't know if you want to, you can have her face it maybe. Huh? We can just have her face it, I think. That'll work. So, good girl. So what we're going to do is I'm just going to kind of come under her chin here. Good girl. And I'm going to check her mandible, okay? So why would I check the mandible? That gives more about it there. But that's why you do want to look at the joint in the jaw as well. It is going to affect completely how you go. So I want to come underneath that joint there. I'm just going to push. That's moving really nice. So I'm going to come over here. Switch sides. Good girl. And then we're going to come right here. So one thing that we're doing a little bit more so you guys can see easy is Katie is going on the opposite side of Cindy from me. If this was a horse that we didn't know, a horse that was spooky or flighty or anything like that, she would be on the same side as me. That's a safety thing. Just because if horses are going to spook, they're going to spook one direction. They can't spook both at once. And if you're both on the same side, they're probably going to spook away from you. The other thing I do up here is I check the pterygoids. It's a muscle on the inner side of the jaw. See how tight that is? If you have bad teeth or you need a dental float, that's going to be really tight. They're going to not like it. And then we also do a little bit of traction on that mandible. You can see she's curling her bottom lip there. She's talking to you like Mr. Ed. She likes it. She loves traction. Good girl. You see she dropped her head there. All right. And then what we're going to do is, lastly, and she drops her head low enough. Maybe we'll go sideways again for this. Sorry, honey, we're going to wake you up for a second. Good girl. I'm going to stick you on the side here. So she put her head back up. I'll see if I can get her to drop, otherwise I'll grab a bail. So I'm going to check her occiput, okay? So occiput is the top part of your skull, right? So I'm going to check that with her. And so if horses pull back really hard on their halter, or were tied or something, or tried to rip a post out of the ground or a tree off the ground, you know, they're going to hurt that pull area. So that's what we're going to check here. Oh, the minute I get on a bit, put your head lower. Okay. So it's all about finding that perfect height so you can get the right adjustment. So, and then she's getting ready too. She's like, yeah, check me out. So I'm just kind of feeling here. That feels nice and loose. We'll check this side. Cindy's not much of a puller. She's a good girl. That feels good. And then we're going to check her her first cervical here. Just going to kind of push down here. Good girl. Just behind that. Okay, so that all feels really good on Cindy. She likes it a lot. And then the last one I'm going to check, and this one you'll see a lot. It's one of the horse's favorite, and it's one of the most distinguishable moves. I'm going to get low for you, honey. Hang on. Is we're just going to check her atlas. Again, this is that pole, and we just kind of rest our head on our shoulder, give each other a big hug, and we feel it. Good girl. We'll check the other side. Good girl. Wind up here. Good girl. So check that, and then the other thing you can do, and like I said, Cindy loves traction, is you just take your hands, you can actually swoop or scoop. So if you have a horse with a lot of neck arthritis, this swoop or scoop is nice. And on little ponies like Cindy, you can actually get pretty far down. What you're doing here is you're kind of working again on those connective tissues, the tendons and ligaments on right here on that nuchal ligament. Okay, so that can get really tight, and then you can also, with enough pressure, now even on a pony like Cindy, I can really only get down the second, maybe the third. No way I'm gonna affect the fourth cervical vertebrae with that, but the second and the third, maybe. Okay, definitely the second. And usually most horses you can scoop the second. And if nothing else, I think they like it further down, just again, because again, you're working on those tendons and ligaments. Everything's held together, everything's connected in the body, and this is just a way to help kind of with that. So we've adjusted Cindy. We've done a lot for her. You can see she's trying to take a nap here. So what we're going to do is we're going to have Katie take her back out, walk away, walk back, trot away, trot back. And sometimes you see a difference, sometimes you don't. So we'll just see how, if we've helped Cindy out here today enough that you can see a difference. My hope is, because I haven't done her in a while, that you will, but you know, horses don't always do what you want. And so we're just going to see what happens here. So what you want to do is you want to look and see, okay, is she moving up better in the back end? Is she walking smoother? Is she coming up forward? Reaching more forward with her hind end there. Looking a little bit looser. Coming forward. Is she bringing her legs more straight? So I think she's crossing over less with her front legs. She's going more in a straight line as opposed to a crooked line there. So here she goes. Trot. Happy little plucky pony trot. There you go. So that's Cindy. Okay, I'm gonna check our time here. Where does it say our time? Okay, so yeah, so that's it for time for us. Kind of ran through that. I think that kind of gives you an idea what we're doing. I'm sure anytime there's something like this, it actually makes more questions than it answers, right? So I always love the backstory, especially after I get to know a horse or a dog. So like I said, I'm gonna try to post a little bit more about Cindy's story, a little bit more about what happened to her and where she is along in her recovery, because she's kind of she's a special little pony for us. And then another time we can try to set up maybe doing a dog for you. It's a lot of the same principles, except there's less to see. If we had time today, I was going to go ahead and do a dog, but we're out of time. You can see more of what I'm trying to do on the horse than with the dog. So a lot of it is the dog's hugged up really close next to me. But we can certainly do that, especially if we get some comments or some interest in that for sure. And then, like I said, we love your posts, we love your comments, we love your questions, and I hope you all have a really nice night. Oh, before I end though, they're going to get mad at me if I don't do my wrap-up spiel. We are running a special on chiropractic and acupuncture because they do work really well together. They both work on the nervous system for this month of February. So if you want to get that in really quick, just give us a call here at the clinic. And then, so that's our special this month. Definitely want to say thank you to the stables. They cleaned out the arena for us here. As you can see, we had it all to ourselves. And then I also want to thank everybody at the clinic that allowed me to do these things for you guys once a month. Kind of talk about what it is that we do all the time and explain why it is that we do it. So again, big thank you to everybody that allows us to bring this to you and help you out with all those things. Be sure to check out, continue to follow us on Facebook and Twitter and all that, TikTok, because we're going to, like I said, if nothing else, we're going to be posting some stuff about Cindy, which is always really fun to learn, in addition to all of our cute videos and photos that we do try to post about the fun stuff we see every day. So with that, have a great night, and thanks for watching.